How to treat and cure multiple sclerosis. Multiple sclerosis, MS, is a chronic inflammatory demyelinating disease that affects the central nervous system, CNS. Several therapies for exist, although there is no known cure. The most common initial course of the disease is the relapsing-remitting subtype, which is characterized by unpredictable attacks, relapses, followed by periods of relative remission with no new signs of disease activity. After some years, many of the people who have this subtype begin to experience neurologic decline without acute relapses. When this happens, it is called secondary progressive multiple sclerosis. Other, less common, courses of the disease are the primary progressive, decline from the beginning without attacks, and the progressive relapsing, steady neurologic decline and superimposed attacks. Different therapies are used for patients experiencing acute attacks, for patients who have the relapsing-remitting subtype, for patients who have the progressive subtypes. For patients without a diagnosis of MS who have a demyelinating event, and for managing the various consequences of MS. The primary aims of therapy are returning function after an attack, preventing new attacks, and preventing disability. As with any medical treatment, medications used in the management of MS may have several adverse effects, and many possible therapies are still under investigation. At the same time, different alternative treatments are pursued by many people, despite the fact that there is little supporting, comparable, replicated scientific study. Stem cell therapy is being studied. This article focuses on therapies for standard MS. Borderline forms of MS have particular treatments that are excluded. Treatment of multiple sclerosis typically constitutes a multifaceted approach involving dietary changes, supplements and lifestyle therapies. While the condition is considered to have no cure, natural options such as these offer relief from the symptoms and underlying issues associated with multiple sclerosis. Eliminating certain foods, adding daily supplements and participating in special therapies effectively treats multiple sclerosis. A disease of the immune system, multiple sclerosis, MS, is defined as a condition in which the immune system eats away the protective sheath covering the nerves. This process interrupts the communication between the brain, spinal cord and other regions of the body and may eventually progress to deterioration of the nerves. The myelin of a patient with MS disappears in multiple areas. This leaves a scar, sclerosis. Multiple sclerosis means scar tissue in multiple areas. The areas where there is either not enough or no myelin are called plaques or lesions. As the lesions get worse, the nerve fiber can break or become damaged. When a nerve fiber has less myelin, the electrical impulses received from the brain do not flow smoothly to the target nerve. When there is no myelin, the nerve fibers cannot conduct the electrical impulses at all. The electrical impulses are instructions from the brain to carry out actions, such as to move a muscle. With MS, you cannot get your body to do what your brain wants it to do. Risk factors for multiple sclerosis. Multiple sclerosis can affect people of all ages. It is more common among people aged from 20 to 50 years. More women develop MS than men. People of European descent are more likely to develop MS, compared to other people. However, people of all ancestries can get it. You can inherit a greater susceptibility of getting MS from your parents. In 2007, the World Health Organization, WHO, estimated that approximately 2.5 million people had multiple sclerosis. Multiple sclerosis rates are higher the further away you live from the equator. This leads many to believe that exposure to sunlight impacts on MS risk. Causes of multiple sclerosis. Although experts are still uncertain, most of them say that the person's own immune system attacks the myelin as if it were an undesirable foreign body, in the same way our immune system might attack a virus or bacteria. Why might our immune system attack the myelin? The reasons could be genetic. Some studies have shown that the genes we inherit from our parents may, in part, impact on our risk of developing multiple sclerosis. If you have a parent, sibling, or grandparent who has had MS, your risk of developing it yourself is greater than average. Several genes are most likely involved in influencing multiple sclerosis risk, experts say. Scientists believe that a set of gene variants we are born with, plus exposure to some environmental triggers, affect the immune system of some people, which eventually leads to MS symptoms. We are probably not that far from identifying those gene variants. Sunlight and vitamin D appear to play a role in MS. Environmental MS prevalence varies according to geographical area and population groups. Multiple sclerosis is much more common in Northern Europe than Southern Europe, Northern USA than Southern USA. It seems that the more exposure to sunlight we have, the lower our MS risk is. The more sunlight we are exposed to, the less likely we are to have low levels of vitamin D, therefore, long-term vitamin D levels probably play a role in multiple sclerosis risk. Italian scientists explained in July 2012 at the 22nd meeting of the European Neurological Society, ENS, in Prague, Czech Republic, that people with high vitamin D levels are less likely to develop MS. In the USA, white people have a higher risk of developing multiple sclerosis than other racial groups, regardless of geographical location. Studies indicate that people who move from a higher risk area to a lower risk one only acquire the risk of the new area if they move before they reach adolescence. This means that there is something in the environment we are exposed to early in life which influences risk. Exposure to a toxic substance, such as a heavy metal or solvent, has been suggested, but no clear conclusions have been reached. People with MS are less likely to suffer from gout. MS patients have lower than average levels of uric acid in their system, which leads scientists to believe that uric acid protects from multiple sclerosis. It is unlikely there is just one trigger, experts say, but rather multiple sclerosis is probably triggered by multiple factors. Infections. Doctors and researchers have often mentioned viruses, such as Epstein-Barr, mononucleosis, varicella zoster, as possible MS triggers. However, this theory has not been backed up scientifically. Too much salt may trigger the immune system, causing autoimmune diseases, researchers from the Massachusetts Institute of Technology reported in the journal Nature, March 2013 issue. The excessive consumption of salt might increase our risk of developing multiple sclerosis.